wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya, Salam Kebajikan bagi kita semua.
Kami di sini akan menjelaskan dan juga memaparkan apa saja alat-alat yang ada di rumah sakit, terutama untuk pasien kanker. Selamat menyaksikan.
Untuk alat pemeriksaan pada kanker payudara, yaitu yang pertama ada mamografi. Nah, mamografi ini memiliki fungsi di mana sinar X-nya itu berdosis rendah untuk mendeteksi kelainan payudara seperti tumor, kista, dan juga kanker. Nah, biasanya dipakai untuk screening rutin agar kanker ini bisa ditemukan sejak awal. Nah, untuk alatnya seperti ini. Nah, untuk cara pakainya, payudaranya itu diletakkan dan ditekan di mesin supaya gambarnya itu jelas. Nah, untuk prosesnya itu cepat dan hasilnya itu bisa dianalisis oleh dokter radiologi. Seperti itu untuk alat. Untuk cara pakainya di sini.
A mammogram is a picture of your breast taken with a safe, low-dose X-ray machine. Your technologist will ask you to stand facing the mammography machine and then place one breast at a time on a flat surface. Another flat surface, called a compression paddle, will gently be lowered into place to compress your breast. Compression is necessary to spread out the breast tissue and to eliminate motion, which may blur the image. The compression may be uncomfortable, but shouldn't hurt. Compression usually lasts no more than 20 to 30 seconds. During this time, an X-ray beam comes from above and penetrates your breast tissue. The X-ray image is either created on a film cassette located below your breast or recorded digitally and stored in a computer. Denser breast tissue, such as cancer or calcifications, appears bright and white, whereas less dense tissue, such as fat, appears dark or gray. After the X-ray is complete, the compression will release and the technologist will change the angle of the machine. Again, position your breast on the flat surface, gently lower the compression paddle, and take one more X-ray. Following the procedure, the images are processed and made available for review and interpretation by your doctor.
Oke, pemeriksaan yang kedua kita bisa menggunakan USG payudara, di mana fungsinya menggunakan gelombang suara untuk melihat kondisi jaringan payudaranya, membedakan benjolan berisi cairan atau padat, serta membantu pemeriksaan biopsi. Ini ya gambarnya. Nah, lalu gimana sih cara pakainya? Nah, cara pakainya itu pertama pasiennya harus berbaring, lalu gelnya itu diolesin ke payudara pasien. Lalu alat pemindainya digerakkan di kulit untuk menghasilkan gambar yang real time di layar, aman tanpa radiasi. Ini video cara penggunaannya ya.
Hi, I am Dr. Amanda from National Cancer Center. Today I'm going to show you how and why we do breast ultrasound. Breast ultrasounds are commonly used for assessment in women under 40 years old, to further evaluate a perceived abnormality in mammogram and to guide biopsy if necessary. Okay, so this is what you're going to expect from a breast ultrasound examination. So today, our radiographers, Lily and Kelly, will be acting as our sonographer and patient. First, you'll meet our trained and friendly radiographer. Then you will lie down on the couch. We will then help to position you appropriately. Our sonographer will then put a water-based gel on the ultrasound transducer, which acts as a medium. She will then scan your breast and obtain some images. This whole process will be painless with no radiation involved. So after the sonographer finishes the scan, she will usually present it to the radiologist and he or she will come and be checked. If the examination is found to be negative or benign, for example, the abnormalities detected on mammogram were found to represent benign cysts like so, usually no further investigation will be required if there is no further concern. If there is a finding that needs to be investigated further, for example this lesion, Your physician or breast team will take it from there. But rest assured that we will be with you and guide you in every step. Happy Breast Cancer Awareness Month!
Yang ketiga, ada MRI payudara. Fungsinya untuk membuat gambar jaringan payudara yang sangat detail menggunakan medan magnet dan gelombang radio. Dan MRI ini tanpa menggunakan radiasi, yang berguna untuk mendeteksi tumor kecil, melihat penyebaran kanker, dan memeriksa kondisi implan. Ini dia gambarnya. Dan cara pemakaian MRI ini, pasien dibaringkan dan payudara ditempatkan di alat khusus dalam mesin MRI tabung besar. Prosesnya lebih lama, sekitar 30-60 menit. Dan ini dia video MRI payudaranya.
Welcome to the MRI Department of Diagnostic Imaging. This is where you'll receive your breast MRI scan. The information in this video will help you prepare for your scan. Before the test, for safety reasons, please tell the technologist if you have any of the following metal devices: pacemaker or defibrillator, piercings, rods, screws, plates, or artificial joints. The technologist will need to verify the type of metal used. Metal dental work like a permanent retainer, IUD or intrauterine device, tissue expanders, cerebral aneurysm clips, spinal stimulators or cochlear ear implants, inferior vena cava or IVC filter or stents, continuous infusion pump, or tattoos. In preparation for the MRI, a nurse or technologist will insert an IV into your arm. This will be for the contrast dye given during your exam. The dye will enhance the images. Tell your doctor if you're allergic to any type of contrast. Also, let your doctor know if you are pregnant or nursing. Before the test, the nurse or tech will explain the procedure to you. There's no special preparation for the exam. You can eat and drink as usual. The scanning portion of the exam will take 30 to 60 minutes. During the test, you will lie in a prone position on a padded table. This means you will be face down and on your stomach. The table has a hole cut out for your face with a padded rest for your forehead. This allows you to breathe comfortably while in this position. Your breast will fall freely during this scan. Contrast is injected into the IV while images are being acquired. The contrast will highlight abnormal areas on the image. It is noisy during the exam. Earplugs are provided to reduce some noise, but you can still hear and talk to the tech through the intercom system. You also can squeeze a special ball to alert the tech if needed. The key to getting good images is to relax and breathe normally. Try to lay still during the exam. Do not lift your head because this will cause your chest to move. The technologist will work with you to find a comfortable position so you can relax. This will allow for the best images. When you focus on remaining still, you may tense up. Tensing up will cause your muscles to twitch, and this will cause your breast tissue to move. This causes images to be blurry. It is important to get a good image because it will help your doctor make a proper diagnosis. Breathing normally is essential. Getting a usable scan the first time means additional scans will not be needed. Some patients need help to relax during an MRI. Try these helpful tips or whatever helps you relax. Picture a calm place. Count to distract yourself. Listen to music. If you took medicine to relax for the MRI, you must follow these precautions afterwards. Do not drive for 24 hours and have an adult drive you home. You may eat and drink as normal. Once the MRI is complete, your IV will be removed. Drink plenty of water after your exam. 4 8-ounce glasses help flush the contrast out of your system. You can ask about your results at your next doctor's visit. Thank you for letting us show you how the procedure works for a breast MRI. Now that you know what to expect, you can make your MRI test successful. If you have any questions about MRI, please ask your nurse or other healthcare provider.
Yang keempat ada PET CT scan, di mana ini menggabungkan pemindaian fungsi atau positron emission tomography atau PCT dan juga struktur yaitu compute tomography atau CT untuk mengetahui metabolisme sel kanker dan kondisi anatomi tubuh. Ini sangat berguna untuk melihat penyebaran kanker dan menilai respon pengobatannya. Ini adalah foto dari PET CT scan. Dan juga cara pakainya yaitu pasien disuntik zat radioaktif khusus yang menyerap oleh sel aktif dan kemudian dipindai menggunakan mesin gabungan PET CT selama 20-40 menit. Berikut adalah videonya.
Gonna get you all set?
PET-CT is a powerful tool in cancer diagnosis and staging.
PET stands for positron emission tomography.
And CT stands for computed tomography.
Sclerotic lesions within.
Radiologist Kelly Schenk explains, PET-CT starts with a radioactive tracer that's injected into your body.
Prior to your PET, it's important that you don't eat for 6 hours because you want all of your cells to be a little bit hungry. Then we inject the glucose, which is tagged with a radio tracer, and then all of your cells that take up glucose will also take up the radio tracer. And the cells that are the hungriest or the most metabolically active will be brighter on our study. So that's a lymph node metastasis.
Those bright spots show up on PET-CT images, helping locate and stage cancer.
Good morning, Laura.
When you arrive for your PET-CT, you'll change into scrubs and talk through the procedure with your technologist.
We'll inject a radioactive sugar that your body will uptake. You sit there for about an hour to kind of make sure that it gets to everywhere we need to go to highlight. After that, I'll bring it into the room, and depending on what we'll do between 12 and 20 minutes worth of pictures and make sure we have everything taken care of and get the answers you need. Just keep holding nice and still.
Because the contrast contains a small amount of short-lived radioactive tracer, patients often ask if there are any restrictions after the exam.
The half-life of the radiopharmaceutical that we use is about 110 minutes, which means in 22 hours, it's going to be completely gone out of your system.
You'll be safe to be around others 2 to 3 hours after your exam.
We'll go get changed. You can hug people, you can do whatever you want, and be as close to your loved ones as you want to be.
Once a cancer is staged, your doctor can lay out a treatment plan based on your PET-CT images.
When I find disease on a PET-CT, and maybe disease that wasn't expected, it's very rewarding to know that we're going to make sure you get properly treated and make sure you treat all of your disease so that you have the best chance at a full recovery.
Semua alat ini saling melengkapi untuk menentukan diagnosis, menentukan stadium, juga membantu pengobatan kanker payudara. Sekian dari kelompok kami. Terima kasih. Sekian dari kelompok kami. Terima kasih. Assalamualaikum. Waalaikumsalam.